generally moving into contact lens wear, regardless of whether you're a child or an adult, the number one thing is it is a process. Okay, it does require some learning. It is actually quite a fine motor skill. It requires some patience. You have to get used to the idea of putting something on your eye. Sometimes, particularly for adults, sometimes it might be a bit challenging to actually see the contact lens. So we've got to work on techniques at learning how do I get this thing lined up on my eye if I have trouble seeing it. So the number one thing is just understand that it is a process and takes time. And I don't like any of my patients feeling like they've failed if they don't get it the first time. And I always say to them, the last thing I want to see is that you've given up way too early, or you felt like you were not good enough. And so I say, I'll keep going while you're motivated to get you there. And my own, I wear contact lenses regularly, and my own sort of journey was a little bit up and down. So I understand that, I'm one of those people that took more time. We can't get it first go. And so probably the number one thing is just being patient with the process. And I don't measure chair time in my practice from a success rate. If you're motivated, I don't see any difference between getting the lenses in and off the first time versus taking 10 goes to get it done. It's all part of the differences in everyone's journey. And that brings us to the other speed thing. A lot of people, they get nervous and they start to rush. And so one of the number one rules when we're learning how to take lenses on and off is just take your time, go slow. People are fearful of hurting themselves, and the eyeballs are, yes, look, they're our precious scents, and we treat them as they're delicate, as we should do, but they are actually reasonably robust, but we do need to take time. And if you're obviously concerned about hurting yourself, then going fast is not the answer. Doing everything slowly is the key one. I find that once people are able to calm themselves and just take time in the insertion removal process, that's when they start to become a lot more successful. And probably the final part of that is, if you're taking time, you become a lot more aware of where your eyelids are and how to manage those. I mean, that's probably one of the biggest factors of trying to get a lens on, is just managing how wide your eyes are, managing the control of your eyelids. And so, once you get your eyelids in control, once you're going slow, then the whole process becomes a lot easier.
Okay. I got to admit, I'm one of the biggest chickens in the world when it comes to anything, like putting anything near my eye, like if whether it's knives, scissors, or knitting needles. If anyone in the room has got those, I'm giving them lots of space. But still, I got used to putting contact lenses in my eye, so if I can do it, anyone can do it. And I think that a lot of people have that initial recoil about touching their eyes, don't they?
Yeah, look, and it's there for a reason. We have these protective reflexes, and you've got the logical part of your brain has to kind of override the reactionary part of your brain to sort of get there. And that's where it's a time and it requires patience to kind of chip away at that.
And I guess hygiene is important as well, like making sure your hands are properly washed, that sort of thing. That's important as well.
Clean hands, clean lenses, clean cases, absolutely. And we talk a lot about water being a risk factor for contact lenses, and being very careful around water activities and getting water on the lens when you're inserting it. But the second biggest source of infections is actually dirty cases. So it's really important to keep your cases clean, replace them as you've been advised to do. And I think this is where kids often do really well, is that the parents being sort of in charge and supervising, they're typically the infection risks are very well managed by the parents compared to maybe some young adults out there looking after themselves.
So my experience with contact lenses was only the soft variety. I never actually even tried the RGP, the so-called hard contact lenses. Do you get many patients who wear hard contact lenses? And if so, is it more of a challenge, or do you find that it's just much of a muchness between using RGP lenses versus soft contact lenses?
Yeah, look, when I first started my training, soft lenses were not new, but certainly newer. And back then, hard lenses were still the healthiest lens for your eye. And one of my mentors, and we talked about his son off camera, Damon Ezekiel. His father was one of the pioneers internationally, and Australians have got a very long history of being pioneers in various forms of the contact lens and ortho-K space, which is something we can be quite proud of. And a lot of the instruments that we use that are some of the top in the world are actually created right here. I'm looking at purchasing another one after being at the conference, and there's some great technology coming out of this country. But what Don used to say was that hard contact lenses are hard on you mentally initially to get used to wearing them, but they're very soft on your eyes. That they still do have one of the lowest complication rates, but they are a challenging lens to get used to in the Australian environment and what I find in Queensland because of the heat, and our outdoor lifestyle means we're out in the dust and the sand and things like that. The old soft lenses used to be, Don used to say, soft on you mentally, easier to get used to, but harder on your eyes. But with the advent of, newer materials, single-use wearing modalities, then a single-use lens is getting pretty close to the sort of low complication rates of a hard lens, but they still have a place. Hard lenses have their place for certain things. Without hard lenses, we wouldn't do ortho-K. Without hard lenses, we wouldn't be able to restore good vision back to people with keratoconus. I have to say that if I have someone sitting in my chair who's worn contact lenses for 40 or 50 years of their life, they're usually a hard lens wearer.
Really?
So they're still out there, absolutely. And so, there's still a place for practices like mine where you still want to have a skill set and being able to fit them, because those people are still out there wearing them. And there's no good reason to necessarily move them into anything else while they're still doing well in them.